Question: have you ever noticed advertisements in malls, grocery stores, or schools that advocate healthy eating, regular exercise, or smoking cessation? Have you ever seen these signs? How about this sign? This one? This one. How about these signs? This one. That one. Oh, this one. These are all examples of health promotion. WHO defines health promotion as the process of enabling people to increase control over and improve health. Before we get going into health promotion, let me introduce the team and their input to this project. Chor Vang, Theory Description Part 1, Sung-hee Kim, Theory Analysis Part 2, and this is Trisha Badong, Theory Evaluation Part 3, and the explainer for the rest of the video. Did you ever wonder who, why, where, how did health promotion come about? Who is the person that paved this path? Well, I got an answer for you. It's Nola J. Pender. She contributed to nursing knowledge of health promotion through her research, teaching, presentation, and writing. Born in 1941 as the only child, parents advocated education for women during a controversial time. At 7 years old, she witnessed care to her aunt and was fascinated with the work of nursing. 1962 RN Diploma, 1964 BSN, 1965 Masters in Human Growth and Development. 1969 PhD in a double major in Psychology and Education. 1982 HPM was born. 1996 it was revised. 1983 Community Nursing. She married Alan Pender, a professor of business and economics. Today she's Professor Emerita. Mr. Webster defines emerita as a woman who is former holder of office, having retired but allowed to retain her title as an honor. Well, I guess I'm calling Dr. Mangini Professor Emerita when I see her. As a research leader, she paved the way of nursing research in the U.S. In 1998, she was appointed by the USPTF as a panel expert. As an educator, she has over 40 years of teaching experience. She has received multiple awards and honors. She has published numerous articles and books. Pender's definition of health is positive, comprehensive, unifying, and humanistic, where health includes a disease component, but not as a principal element. Nola was motivated to create HPM. She noticed professionals only intervened once a person was sick. She wanted to create a theory with positive motivation. Having her own family, she wanted optimal health throughout the lifespan. Influenced from her husband, she believed she could save healthcare dollars. Take a deep breath. We're going on a deep dive on Theory Description. Part 1. The purpose of the theory was to assist nurses in understanding the major determinants of health behaviors as a basis for behavioral counseling to promote healthy lifestyles. The meta-paradigms: person, biophysical organism, environment, social, cultural, and physical context, nurse, collaborator with the individual and community, health, actualization of human potential to maintain structural integrity and harmony with the environment, illness, discrete event that hinders health. The goal of HPM is to focus on helping people achieve higher levels of well-being and identifies background factors that influence health behavior. Theory definition of the health promotion model. People are the sum of their experiences, and their future choices are weighed through perceptions, current social interactions, and competing demands that lead to behavioral outcomes. Now, let's break down the health promotion model diagram by defining the following terms. Health promotion is approach to wellness. It is defined as behavior motivated by the desire to increase well-being. Health protection is illness prevention, described as behavior motivated, actively avoiding illness. The main concepts of HPM are divided into three categories. It's the individual characteristics and experiences, the behavior-specific cognition and affect, and the behavioral outcomes. The 2 of 8 sub-concepts that the nurse needs to assess are prior related behavior, which is the best predictor of behavior, personal factors that shape the target behavior. It could be biophysical, psychological, and social-cultural factors. The other 3 of 8 assessment targets of the nurse are perceived benefit of health, perceived barriers to action, perceived self-efficacy, activity-related affect, interpersonal influences, and situational influences. The 2 other concepts of HPM are the immediate competing demands and preferences, which are obstacles that intrude consciousness, hindering a planned health-promoting behavior. Commitment of plan of care, intention, and identification of planned strategy that leads to a health-promoting behavior. Geez Louise, that was hard. Well, let's move on. Here are the 6 assumptions of the health promotion model. Number 1, people are motivated to affect conditions so they can achieve human potential. Do you get it? Human potential? Superman. Number 2, people have the ability to assess their competencies. They are self-aware. Self-aware? Selfie? Do you get it? Number 3, people value positive growth. They seek balance between stability and positive change. Number 4, people are active in regulating their actions. Number 5, people affect and are affected by the environment. Number 6, people are influenced by healthcare professionals. Did I say 6 assumptions? I guess there's number 7. Number 7, self-motivation is key to behavior change. What? There are 14 theoretical statements? Okay, here we go. Here are the 14 theoretical statements. Number 1, prior behavior and characteristics influence belief and behaviors. Number 2, benefits are instrumental with behavior change. Number 3, barriers play an important role in behavior change. Number 4, self-efficacy or competence increases likelihood of behavior change. Number 5, self-efficacy results in fewer perceived barriers to health behavior. Number 6, positive affect towards a behavior increases self-efficacy. Number 7, increased commitment in action results from positive emotion and affect. Number 8, significant others are influential in behaviors. Number 9, interpersonal influences impact health-promoting behavior. Number 10, situational influences impact health-promoting behavior. Number 11, the greater commitment to a plan of care, the more likely the health-promoting behavior can be maintained over time. Number 12, when competing demands requiring immediate attention are present, this may reduce the likelihood of the desired behavior. Number 13, cognition, affect, and environment can be modified to create incentives for health actions. Before we move on to the final statement, let's do an icebreaker question for all of you. That includes you, Coco. Hey, Coco, are you sleeping? And the question is, what would you rather? And you could only get to choose one. Would it be a healthy, succulent apple or a chocolate bar? Apple versus chocolate. Raise your hands if you picked apple. Now raise your hands if you picked chocolate. Who wins? If you picked an apple, congratulations, you won an apple. If you picked a chocolate bar, congratulations, you also won an apple. This is HPM, guys. We are not giving out candy bars. Empirical testing. A Sinal research in 2008 revealed listings for 235 English language articles that used HPM. I know, Melissa. I know how you're feeling. We're almost there. We're headed to part 3.